Talk Radio 640 WGST. Welcome to HealthTech Talk. This is where business, healthcare, and technology collide. Our host, Ben Chodor, interviews healthcare innovators and industry titans who are striving to make the world healthier with bleeding-edge human ingenuity. You'll hear it all on HealthTech Talk. Now, here's your host, Ben Chodor.
Good morning, good afternoon, good evening, wherever you are. I am Ben Chodor, and you're listening to HealthTech Talk, broadcasting live from 640 WGST and streaming worldwide on the iHeartRadio network. I know I say this every week, but we have a really good show for you today. So you're going to want to stick in for the whole hour because this is going to be a lot of fun. And, you know, today we're all about the patients in the end of the day. We're about how we are going to involve physicians and patients to create a healthier world. And it's been a great week. I want to remind our audience, next week is Mother's Day. So get excited. Think about your moms. And then also I want to remind our audience that our archives are available not only on iTunes and YouTube and SoundCloud, but on Vimeo and also at www.healthtechtalk.com. So you're going to want to check in. But I don't want to waste any more time, but I want to bring in my first guest. He's Matt Tindall. He's the General Manager of Consumer Solutions, IMS Health. The product that we're going to talk about is AppScript. You can check it out at www.appscripts.net, or you can actually go to, Twitter and look at it at AppScript. And it's amazing. All right, so it's all about, they're a leading discovery and distribution platform for mobile health technologies. So, again, check them out at AppScripts. Matt is an experienced commercial leader with more than 2 decades experience. I've met Matt. There's no way you've been in this industry and doing this stuff for two decades. You're way too young. And his experience in healthcare ranging from tissue transplantation, gene therapy, cell therapy, genomics. It goes on and on and on. And the focus of today and the focus of AppScripts is it's all about discovery and distribution platform for mobile health technologies. Matt, welcome to the show. How are you today?
Hey, Ben. Thanks very much for having me on. I really appreciate it. It's an honor to be here.
Well, it's awesome. So first of all, I got to let the audience know I am really interested in what Matt's going to talk about and what the company's going to talk about, because myself, I've been part of a startup in the space of apps and giving apps to the patients. I really think what IMS has done with AppScripts is really incredible. It's a huge organization. I'm going to let Matt tell you a little bit about the company. But, Matt, I want you to paint a picture to our audience. What is it that you've created, and why is it important for both the patient and the physician?
Sure, thanks. So about 2 years ago, we started thinking about this new space of mobile health technology, and we realized that it was a very complex and sophisticated space with hundreds of thousands of apps out there and devices and content that was in some ways very difficult to sift through for any provider, and provider meaning healthcare provider, physician, nurse, pharmacist, others, as well as patients. And so we started to simplify, or try to simplify, this really complex world of mobile health and connected health by looking at each of the products in the space at a very deep level. So starting with, I think, 60 metrics, we started to look through each of the apps that were truly healthcare apps and tried to curate the ecosystem so that it was easily discernible for doctors and patients alike to see which apps had varying degrees and hopefully high quality, and separated out those high quality apps from the apps that are not really healthcare apps. For instance, those that make you look skinny or project your image on the wall in a different format. Those are not healthcare apps, and we started to strip those out. And what we've built with AppScript is really that simple interface that a doctor would use to come in and sift through what would be a simplified formulary of the highest quality apps by condition for patients that need it in real time. AppScript allows a doctor to find the right app for the right patient at the right time and distribute that app to the patient via our platform to their cell phone in their pocket in between about 5 to 20 seconds.
So Matt, let me ask you a question. So is the concept as a physician, I'm with a patient, I say, hey, you have high cholesterol and you have high blood pressure. I'm going to put you on Lipitor and this drug. And also, by the way, I'm going to prescribe you a blood pressure cuff and an exercise app. I mean, is that, so it's going to tie in with medicine? Is that really what the goal is?
Well, that's exactly right. I mean, we've seen a very strong correlation between, let's say, glucose monitoring and a glucose app that helps you stay in range. I think there's an important view here, which is that apps even alone can help to engage patients, and help them achieve better outcomes from, or at least a healthier lifestyle. We know that from what we see with apps like MyFitnessPal and other apps that that get people up and moving. One of the apps that rises to the top in our prescribing behaviors within AppScript is Everybody Walks. It's a Kaiser Permanente app, and it essentially monitors and tracks calorie burn when patients walk. So, it's not only about combining these apps with a drug, but it's certainly a use case, yes.
That's awesome. So tell us a little bit more. So how does the consumer get involved with AppScripts, and is the whole selling mechanism of the organization, are you approaching physicians and payers and hospital systems? I mean, what's the whole goal? How are we getting the word out there?
Sure. So let me tell you typically how we use AppScript. We go into a provider organization like a Carolinas healthcare system, and we work with the innovative physicians there to deploy the system so that their doctors can, in a consultation, let's take a use case like diabetes.
Yep.
Doctor and patient have a conversation. Patient's been diagnosed with diabetes. Doctor says, hey, here's Lantus, a drug that I'll prescribe to you to manage your condition, as well as, I think you could probably use this app like an IBG Star app and a piece of content like a Living with Diabetes content piece from YouTube or another content source. In that moment, the doctor has that very brief conversation, offers new tools, and delivers that content directly to the patient's pocket, typically before they even leave the consultation suite. Now, that patient then gets a prescription on their phone, easily downloads the video from YouTube, easily goes to Amazon or Best Buy, to the retail online retail stores and buys the glucometer in this case, and then also goes to one of the app stores to pick up the app. Now, we work with these provider organizations as well as online publishing portals and EMR companies to get closer to the workflow of the physician, to get closer to the highest transaction value between the physician and the patient, which is their mobile device. And as you know, most patients don't stray from their mobile device within 3 feet any time during the day. So, the most engaging place to put this content is in their phone. The way that we work with, institutions is today, it's available today, at appscript.net for free. We want prescribers to be prescribing apps all day long to patients because we're seeing now signals of outcomes in the ecosystem from organizations like Partners Healthcare, Penn Medicine, that show between 40 and 53% reductions in things like cardiac readmissions. So we want to provide this platform as wide as we can. The business model, is something that is in our case, for the most part, secondary at this point.
So Matt, I want to interrupt you. I need to interrupt you for a second because I want to talk about the business model. But it's that time where I need to cut to commercial. I want to thank everyone at 1-800-Public Relations for all their media and PR support. I want to thank Paul in the booth, and I want to cut and say thank you to our sponsors.
This is an announcement for all people who want to take a risk-free challenge to whiten their teeth in 5 minutes using clinically proven power swabs. This risk-free challenge is for people whose smile has been yellowed by coffee, tea, or smoking. It's so effective, we challenge you to try it for 5 minutes to see how white your smile could be. If lines are busy, try again. Dial 1-800-663-5922. That's 1-800-663-5922. 1-800-663-5922.
Hello all, I'm David Nicholas, host of Protecting Your Retirement right here on 640 AM WGST. We've got a new show time starting Saturday at 10 a.m. and Sunday at 10 a.m. right here on 640 AM WGST. We hope to see you then.
Attention. This is the Alarm Force Central Station. We are receiving a panic signal. Is everything okay?
It's Jane. My password is 452. I just heard glass shatter downstairs.
Jane, stay calm. The authorities are on their way, and we'll update them on your situation. I'll stay on the line with you until help arrives.
No phone line at home? No problem. Go wireless with Alarm Force's cell wave technology, installed at no charge for a limited time only.
Call 1-800-267-2001. Alarm Force.
The sizzle of a steak on the grill. The crashing of waves on the beach. And whatever that is. At iHeartMedia, we have harnessed the power of sound in a way that can help you expand your reach to a new group of target customers and grow your business through customized and effective advertising, big or small, local, regional, or national. Our iHeartMedia consultants are ready to help. Call 844-BUY-RADIO or go to iHeartMedia.com.
Financial independence, wealth empowerment. You'll only be wealthy once you know what the wealthy know. Once you're ready for strong returns while preserving your principal, you're ready for Heroes Talk Radio. Learn the secrets to planning a tax-free retirement income Saturday mornings at 8 a.m. right here on Talk Radio 640 WGST.
This is Jeff Foxworthy. When I was growing up, I had heroes like Batman, Spider-Man, and any man scooping ice cream. Today, my hero is an organization called Cure Childhood Cancer. They are doing all kinds of heroic things that you should know about. The moment a child is diagnosed with cancer, Cure joins the devastated family and stays with that family throughout their frightening journey, however long or bad, providing guidance, compassion, and whatever help that family needs. And that relationship is forever. Cure works year in and year out to provide badly needed funding for the specialized research required for childhood cancer. This critical funding is working, folks. We are getting closer to eliminating this dreaded disease in our lifetime. You see, Cure would never use the word hero. They'd use the word help. Please help Cure save children's lives. Believe me, you'll be a hero too. Donate at curechildhoodcancer.org.
Our iHeartRadio app. Here's another little sample.
Let's go.
Fireball.
Ladies. Yes, you've been got. Help. Red Solo Cup.
Music and radio in one free app. Create your own custom stations. Listen to the best live radio stations across the country. Open our iHeartRadio app today. Or listen online at iHeartRadio.com.
All the wonders of the smartphone. You can check out WGST's Facebook page, listen to us on the iHeartRadio app, follow us on Twitter, and even call us. Use your smartphone to connect with us, and you're connected to your radio station. Talk Radio 640 WGST.
Welcome back, and if you're just tuning in, you're listening to Health Tech Talk. I'm Ben Chodor, and we're broadcasting on iHeartRadio at 640 WGST and streaming worldwide on the iHeartRadio network. With me is Matt Tindall. He is the General Manager of Consumer Solutions, IMS Health, and his product that we're talking about today is AppScripts, and you can check it out at www.appscripts.net. It's all about, think about apps and devices and how it works in the world of healthcare. It's not just about providing medicine. It's not just about treating the patient. When we send them home, how are we going to stay engaged with them? How are we going to keep them healthier? What better way than giving them something on their device? We were just talking about the company in general, but we were talking about the business model. So what is the business model of AppScripts for IMS?
Sure. Yeah. So, we're really focused on discovery and distribution of these app products, app devices, and content. And when we think about the business model, there's a very popular business model now that's been spread through the social media, properties like Facebook, which is click to install. Our partners want their apps at the top of AppScripts. We have a featured row at the top of the free version of AppScript that you can find at appscript.net. And, we allow our partners to come in and place their apps in workflow, in physician workflow, so that physicians can be made aware of their apps in the moment that they're prescribing these apps to patients. And so, the business model is really a click to install model. And, we're very excited about the progress we're making. We've had, a 300% increase in registrations in the past week. So we think this is, scaling fast and exciting.
What's driving it more, Matt? Is it the patients going into their doc's office going, hey, I have diabetes. I was looking at glucose monitors on iTunes, and there's 250 of them. Which one should I use, doc? Or is it docs going to their administrators going, hey, I want to start engaging with the patients more when they go home? Where's the groundswell coming from?
Yeah, sure. So doctors want to be and are experts. When the patient comes and asks about apps, you can imagine that causes a little bit of heartburn for most doctors today. It's not a typical practice for them to have a conversation today with patients about what the best apps are and how to distribute it. In fact, there is no distribution model right now for most app developers in the healthcare space. They send their patients, and doctors send their patients directly to the app stores, and then the patient hunts and pecks around until they find the app that they think they remember the doctor recommended. So, it's a bit of a push-pull. The doctors want to be experts, and they want to know which apps would be, highly recommended by trusted institutions like IMS Health. And they also want to be able to distribute these products to patients. Now, patients don't necessarily want to hear verbal or written on the back of a napkin recommendation from the doctor. They want it in their hand, in their pocket. So, we've created a system here that closes the loop on the transaction between patient and physician. And so it's really driven by both parties. We're in the midst of validating whether or not we can change the behavior of doctors and patients with respect to mobile health technologies. And we're, just like any startup would, we're validating the case that doctors will prescribe. Doctors have shown us that they're willing to write about 3.1 prescriptions per day. So that's a pretty big finding. I don't think that's heard anywhere else in the field. And then also that patients are adherent to their apps or wearable device recommendations by doctors to the tune of about 54% at the end of a 1 month period. Now, in contrast, Flurry publishes data that says that patients are adherent to their mobile health technologies that they find on their own about 20% at 1 month. So it's a big improvement.
Yeah, and I'm a big believer that apps in healthcare don't always have to be forever. They're to help me change my behavior. So I think in a lot of cases, if I'm using an app that was prescribed by my doctor and I learn it and I use it, then I don't always have to be always engaging with it because it's changed my behavior. And that's really what we want to do. We want to create a healthier environment for patients. So which leads me to my next question. So listen, IMS, I've known IMS forever. You guys are all about data. You know every pharmaceutical script that's ever been written as an organization. And so now we're turning into this. How important is the data loop back to the physician community and the information we can learn when you tie in, traditional pharmaceutical and digital health?
Yeah, good question. I think, it's more important than people currently give it credit for. I think, there's a lot of wellness trackers and, run trackers and calorie counters and things that some physicians might not feel need to be in the EMR. We are seeing tremendous data and findings in some of these apps that does need to wire back into the EMR so the doctor can make better decisions. I think as we mature, as the health industry matures, what IMS Health is doing is trying to determine how to efficiently ascribe outcomes data to each of the apps, and sort of in broad scale map each of the apps or mobile health technologies more plainly to outcomes, to data, to clinical data like prescription claims data or medical claims data, and using cohorted sets of patients, we can determine whether patients with apps and devices behave differently than patients without apps and devices. And so getting to the outcomes is the most important thing to show to a physician and to a patient. And we're trying to push that into to the EMR ecosystem. So again, they can look at appscript.net, the product, and they can determine whether the app that they're looking at has clinical value.
Right. And so Matt, are the EMRs, so just so everyone knows, this is where in most hospitals and doctors, it's where your patient information is going to be. So this is where everything's stored. Are they embracing this, or are they a little standoff and wait and see still in the space?
Yeah, I think everybody in the industry has their own interaction with the EMR business, the EMR industry, and ours is simple. We think this belongs in workflow. We're working with a top 5 EMR company today to place it in workflow. I think they're slow to adopt almost every new technology, frankly, because they're so overwhelmed by the interest in getting into that workflow by hundreds of technology vendors. In some ways, just like us. I think that the end game is to make sure that doctors can prescribe a drug, they can prescribe a mobile health technology, and they can prescribe any device, whether that be a device like an ACE bandage or a device that is a wearable technology, as well as an app that is helpful, like the glucose meter, glucometers, and other tools that I mentioned earlier.
So Matt, I got a question. So in www.appscripts.net, how many apps have you curated to this point?
Yeah, so we looked at approximately 125,000 apps at a high level, and then we dug down into 63,000 of those that we determined to be truly health apps, and then did a significant analysis beyond that with, I think it's over 60 now, 70 metrics that we use to evaluate these apps, and got it down to an area roughly about 24,000 that we typically include in any product. So we're really segmenting the market by value and then providing the scores in an unbiased way to the marketplace to make their own call on what apps are appropriate for what patients.
That's great. So I got a two-sided question to ask you. My first question is, when are we going to start seeing more and more apps that do something? The way I keep on saying on my shows, I keep on seeing apps and devices that are like thermometers. So take our temperature, they'll tell us what we did. But when are we going to start seeing apps that actually do something, that help me with my health care? And are you seeing that? Because obviously you're deep in the space. So are you seeing that? Does that get you excited? Or do you think there's still room for new apps that actually do something?
Yeah, we are. We're seeing tremendous development. A lot of it comes in the space where you're connecting a sensor to an app. I think we just did one of our App of the Week segments on AliveCore. They have an app that's the Alive ECG app, and that couples with the AliveCore monitor for heart rhythm disorders. And, we're seeing a lot of really, strong advancements by companies that are, well-funded, that have great ideas around how to sort of sense things in the body that can couple to a visualization tool so the patient can, remain engaged over time. And so that signals can be understood by the patient before they even admit to the hospital. Now, on the flip side, there's a lot of app developers out there that are developing, trackers that are connected to a portal, and that portal the doctor needs to access and open. There are thousands of those, apps out there that require a provider to access a portal. We think that's a little bit problematic when you think about the 100,000 or so apps out there that are available. So there's goods and there's bads. I mean, there's pros and cons about this space right now, but we do think there's a lot of really strong and advanced and sophisticated apps being coupled to devices and apps alone that are, serving to teach us a little bit about how to keep the patient's attention, how to nudge or move them along their treatment journey, and how to keep them out of the hospital.
That's great. And I got to also say that a couple weeks ago I had Dr. Albert from AliveCore on our show, and he was a big hit. Our fans gave a lot of responses back about it. So I got to ask you, I'd be remiss if I don't ask you this. The Apple Watch kind of officially came out this week. How does that play in the app development going in the future, and where do you see it playing?
Yeah, I mean, I think it's tremendous that I guess I would say the board or the one machine has moved from the desktop to the phone to now your wrist and soon in your eye. The Google Diabetes Project to your eye. We're 100% interested in understanding now that the Apple Watch has launched how this is going to impact the ecosystem and how it's going to impact downloads and patient behaviors. We think it's going to be terrific. So, we're super excited about it.
That's awesome. And, Matt, I can't believe 2 segments have flown by. I am out of time with you. I want to remind the audience that we were talking to Matt Tindall. He is with www.appscripts.net. Check it out. It's all about apps for patients. I need to take a break.
Atlanta's compelling talk. Talk Radio 640 WGST is available anywhere you go on the iHeartRadio app. Download it now at WGST.com.